Tracking the vaccine for you this afternoon. People 65 and older, as you know, can now get vaccinated starting today. But we are also getting a better view and understanding of who is not getting the vaccine. Channel 3 Eyewitness News reporter Mike Savino is live right now in Hartford with a closer look this afternoon. Mike.
Yes, Mark, we got some new numbers just yesterday from the Department of Public Health showing that black people here in Connecticut are just not getting the same access. So what kind of a gap are we talking about? Well, as of February 3rd, so just a week ago, 48% of all people 75 and older have gotten at least their first dose of the vaccine. But when you break it down just to African Americans, it is just 19%, so less than half of what we're seeing for the overall statewide rate. And you talk to people, even those who are giving out the vaccine, and sadly, they say that this is just not a surprise to them. Now, the way we're giving out most of these doses is through these drive-in clinics, and that's obviously allowing a lot of people to get the vaccine quickly, but it's also leaving behind some of the people here in Connecticut. So how do we solve this problem? How do we get this vaccine to them? Well, I talked with one vaccine provider today, and she says obviously we have to find ways to get into the communities. One way being partnering with local doctors who have the trust of their clients. Also, mobile clinics, getting into senior centers, getting into areas the same way that we were getting testing out into communities. But I also talked with an activist who is just quite frankly skeptical that we will see any kind of noticeable change. He points out that black people have also been more likely to get the coronavirus and die from it, and yet that continues to be a problem. Well, this vaccine provider says that is exactly why we have to try some new things.
It is absolutely a public health issue, and so we need to address this as a public health concern. And so if that means business is not as usual.
When they're known, when there's some light shined on them, oh, isn't this a shame? Shouldn't we do better? But I think we absolutely, fundamentally just pay lip service to them.
Now, Bishop John Selbers of Moral Mondays, Connecticut, who you just heard there, he does agree that there are solutions out there. His question is whether or not we're going to do the things we need to tackle the underlying systemic racism in healthcare that allows for these disparities to happen. I did reach out to the Department of Public Health to get a response from them about what we might be doing statewide. So far, we have not heard a response from them. Live from Hartford, Mike Savino, Channel 3 Eyewitness News.